I am here with Banu, and Banu, you were in about a year ago for a half-mouth scaling and root planing, meaning you've already been diagnosed with some sort of periodontal disease, periodontitis. So you might be familiar with some of it, but maybe you weren't properly educated on it when you were last in. So let's first go over what is periodontal disease, periodontitis, and then we'll talk about what I found in your clinical, medical history, dental exam, and then we can talk about treatment and where to go from there. So, first, periodontal disease, do you know what it is?
No.
Okay, so periodontal disease is also commonly referred to as gum disease, and it is caused by a buildup of bacteria called plaque or calculus, or it's caused by a buildup of plaque that eventually hardens and mineralizes into calculus. Have you heard of those terms before?
Yeah, maybe once or twice.
Calculus might also be referred to as tartar, and it just builds up in your mouth and then irritates your gums and eventually infects them and causes a disease.
Wow.
So in order to measure your severity of disease or to see how healthy your gum tissues are, we use something called a periodontal probe, which is basically just like a ruler, and it has different millimeter markings, and we just check to see what that measures, and we record them and keep track of them. So in healthy teeth and gums, you see here that the probe measures about 1 to 3 millimeters. That's what we want to see for every single tooth. And then we can see that it's surrounded by fibers and tissues, and it is supported by your bone. There's no bone loss, there's no inflammation or redness anywhere. It is completely healthy and no disease is present. If disease is present, your probe, first it is gingivitis. That's the early stage of periodontal disease. And it might be a little bit red and inflamed, your tissues. And the probe might measure about 4 millimeters or so. But there's no evidence of bone loss, making this the only form of periodontal disease that is reversible. So if you keep up good frequent professional care and maybe change your at-home care, then your gingivitis will be able to go away. If the disease is left untreated, it will progress into early periodontitis, where you see bone loss, and because the bacteria is starting to break down the supporting structures, you see more red and inflamed tissues, and then you get a probing depth of about 5 millimeters. And the only way that this can be untreated is through coming in for scaling and root planing or some sort of non-surgical surgical therapy, and then perio maintenance, so frequent professional care of about 3 months. Your tissues start to pull away from your teeth, and yeah, if this is left untreated, then it will go into moderate periodontitis and possibly even advanced periodontitis. So you can see in moderate that the probing depth just gets deeper with maybe about 6 millimeters. More bone loss is evident. You are able to see that on radiographs, and more tissues are pulled away from the tooth. You might start to get tooth mobility. As that bone decreases, you might get ripfurcations, meaning the root is exposed. And if it progresses into advanced periodontitis, which is what I might be seeing in you, you have a probing depth of 7 millimeters or greater, severe bone loss right there. So you can see that would be a healthy one, and you've just lost about half your bone in advanced periodontitis. There's no way to regrow that, so you want to treat that as soon as possible, and just try to manage that, or else it'll just keep going, and eventually we'll have to extract your teeth. And yeah, so some signs and symptoms of why I think you might